Welcome. So, what if I told you that you could tap into your body's own incredible healing power through your ear? It sounds a bit like science fiction, doesn't it? Well, today we are going to explore a simple, ancient practice that modern science is now proving might just be a powerful tool for some of our most common and most frustrating health issues.
Let's just start with the big question right up front. Could something as simple as a tiny seed carefully placed on your ear really send a signal powerful enough to relieve pain, calm down a stressed out gut, or even help lift your mood? I know, it sounds almost too simple to be real, but that's exactly what we're going to dig into.
And let's be real for a second. These issues on the screen, they're not rare. So many of us are dealing with this stuff, that chronic pain that just lingers, or digestive problems that mess up your whole day, that low-level hum of anxiety that never seems to turn off, or just the bone-deep exhaustion from not being able to get a good night's sleep. People are looking, really searching for solutions that are safe, effective, and that they can actually access. And this is where our story really begins.
All right, so let's get into what this is all about. We're talking about something called auricular acupoint therapy. Now, I know the name sounds a little technical, a little complex, but the idea behind it is actually beautiful and surprisingly simple. It's all about seeing the ear as more than just for hearing. It's about seeing it as a tiny, detailed map of your entire body.
So, what is it exactly? Well, auricular acupoint therapy, let's just call it AAT for short, is a completely non-invasive treatment. We're not talking about needles here. Instead, it uses these tiny little seeds. They often come from a plant called Vicaria, or maybe little metal or ceramic beads, and they're just taped onto very specific points on the ear. The whole goal is to create this gentle, sustained pressure on those spots, which is believed to kickstart a healing response somewhere else in your body. Now, this is a really important point to make, because we need to clear up a common mix-up. The second you hear acupoint, your brain probably jumps straight to acupuncture needles, right? But ADAT is a whole different ballgame. It is non-invasive. Nothing punctures the skin. It's all about that gentle, steady pressure, which, makes it way more approachable for a lot of people. It's even something you can learn to do yourself at home after getting some guidance.
So, while the general idea of using the ear for healing has roots way back in traditional Chinese medicine, the modern version of AAT that we see today really took off in a surprising place. 1950s France. It was a physician there, Dr. Paul Noger, who had this incredible aha moment. He noticed that the map of these specific points on the ear looked, amazingly, like an upside-down fetus. He's the one who created this detailed ear map, and that single discovery just sparked this huge wave of global research, bringing this ancient practice squarely into the world of modern medicine. And this brings us right to the core idea, the ear as a microsystem. Just think of it like a little control panel for your whole body. The belief is that by stimulating one tiny point on this control panel, you can directly influence the part of the body it corresponds to. For instance, there's a super famous point called Shenmen, or the spirit gate. It's the go-to point for calming the mind and easing stress. Other points are linked directly to organs like your stomach for digestive health, or your heart and kidney for helping to regulate your mood and get better sleep. Okay, so we've got this fascinating theory, right? And this long, long history of people using it. But the big question for us today is, what does modern science actually have to say about it? And this, my friends, is where things get really, really interesting. Because researchers are now putting AAT under the microscope, testing it rigorously, and moving it from the world of traditional wisdom into the world of evidence-based medicine. Now, to do that, they often use this incredibly powerful research tool called a meta-analysis. Think of it this way. Instead of just relying on the results of one single study, a meta-analysis is like the superhero of research. It gathers up all the data from lots of different high-quality studies on the same topic and combines them. This gives us a much bigger, much more reliable, and much more confident picture of whether a treatment actually works. It's really considered one of the highest levels of scientific evidence you can get. And wow, when researchers started to do this digging, the sheer scope of what they found was kind of staggering. In just a 10-year review of the clinical literature, they found that AAT has been studied for, get this, more than 130 different health conditions. We're talking about everything from insomnia and anxiety to digestive problems, pain management, and so much more. So let's zoom in on a few of the biggest areas of research. And we have to start with mood and sleep. Given how many people are struggling with depression, anxiety, and insomnia, finding safe, non-drug options to help is a massive priority for the medical community. So what's the verdict? Well, one huge meta-analysis pulled together the results from over a dozen different studies focused on depression, and the conclusion was pretty clear. AAT led to a significant, measurable reduction in depression scores. Other big reviews found the exact same thing for anxiety. The researchers' takeaway was that it's a safe and effective complementary therapy. That means it's something that can work really well alongside other treatments. And here's a cool bonus. It also helped improve sleep quality, and we all know how deeply our sleep is connected to our mood.
Okay, next up, let's talk about pain. This is one of the #1 reasons people go looking for alternative therapies in the first place. And researchers have zeroed in on a very common type of pain that affects millions: menstrual pain.
This is so cool. One incredible study did a massive head-to-head comparison of a whole bunch of non-drug therapies to see what really worked the best, and the results were fascinating. When they ranked the most effective treatments for period pain, auricular acupoint therapy was right there in the top 3. It was right alongside well-known heavy hitters like acupuncture. That tells you it is a serious contender for pain relief, all without having to reach for a pill bottle. All right, the third major area where AMRT is showing some serious promise is gut health. And we're talking specifically about conditions that are known as functional gastrointestinal disorders, or FGIDs. You've probably heard of the big ones like irritable bowel syndrome, IBS, and functional dyspepsia. A massive systematic review gathered up data from almost 20 different trials, which included thousands of patients. And the result? A2T was significantly more effective at helping with these tricky gut issues. But here's the part that really blew my mind. It didn't just help with the physical stuff, like the bloating and the pain. It also improved anxiety and depression that so often go hand in hand with these conditions. That is a powerful, powerful demonstration of how this therapy might be able to influence the entire gut-brain connection. Okay, so this all leads to the million-dollar question, doesn't it? We've seen the evidence that it does seem to work, but how? How on earth can pressing a little seed on your ear affect your gut or your mood or how you feel pain? Well, this is where that ancient wisdom and modern neuroscience really start to talk to each other. There are basically 2 main ways of explaining this. You have the traditional Chinese medicine perspective, which talks about it using concepts like meridians and qi, or vital energy. The idea here is that pressure on these ear points helps to unblock and rebalance the flow of this energy, restoring harmony. Then you have the modern neuroscientific view. It offers a different, but you could say a complementary explanation, and it focuses on the very special, very unique nerve anatomy of the ear itself. And the absolute key to this modern explanation is a specific part of your ear called the concha, that little bowl-shaped area in the center. And this is just mind-blowing. That tiny patch of skin is unique. It is one of the only places on the entire surface of your body where a massive internal nerve superhighway, called the vagus nerve, comes close enough to the surface to be stimulated from the outside. I want you to think of the vagus nerve as your body's master remote control. It is a massive information highway that connects your brain to pretty much all of your major organs: your heart, your lungs, your entire digestive system. So when you apply pressure to one of those special points in the concha, you're essentially pressing a button on this remote control. That signal zips right up to your brainstem, which then sends messages back down that superhighway to help regulate all these vital functions. This is the modern scientific model for how AAT can directly influence that gut-brain axis, calm your nervous system, and help your body find its balance. So when you pull all of this together, the history, the evidence, the neuroscience, what's the bottom line here? What are the big takeaways? Well, it really positions AAT as this remarkably simple, low-tech healing tool that happens to have some very powerful, very modern benefits. Let's just break down the big advantages that the research keeps pointing to. First, it is incredibly safe. The most common side effect reported is just a little bit of temporary skin redness, no big deal. It's also really affordable, especially when you compare it to a lot of other treatments out there. And maybe the most important part, it's convenient and it's accessible. Because it's a non-invasive, drug-free option that you can often learn to manage at home, it really puts more of that healing power back into your own hands. So, to wrap it all up, what the science is telling us is that auricular acupoint therapy is emerging as a really promising, evidence-backed complementary therapy. Now, it's not a magic bullet, it's not a cure-all, but it is a powerful and legitimate tool for helping to manage the very complex, very interconnected symptoms of the gut, our mood, and pain. And that leaves us with one final big question to think about. As the science continues to grow and we learn more and more, could this incredibly simple ancient therapy, a therapy that works by tapping into our body's own wiring, truly be one of the keys to unlocking modern wellness? It's definitely something worth thinking about.
Thanks for joining me.